Okay, what I'm talking about here is some empirical treatment of urinary tract infections and prostatitis. So starting off, we're going to be looking at acute, uncomplicated cystitis, as I've written up here. So what kind of bugs are going to cause acute uncomplicated cystitis? Typically it's going to be E. coli and maybe S. saprophyticus. I'll just put S. sapro. Okay. So those are the pathogens. But what treatment are you going to use? Well, there are four possibilities here. I'll list them. There is a combination of trimethoprim and sulfamethoxazole, which usually, since those are like really huge names, they just usually put TMP plus SMX. And if you don't want to use that one, you can use, I realize this is going to take up more room than what I have here, so I'm going to erase these bottom ones and rewrite them. So you can use TMP, SMX, or you can use fluoroquinolones. Just going to put fluoro. Or you can use nitrofurantoin. Or you can use beta-lactams. Being like penicillin, cephalosporin, things like that. So those are the options. So some comments on that, though, is that usually the short course therapy is more effective than a single dose treatment. I think it's the nitrofurantoin, which is the single dose treatment, but anyway. Next one. So that was cystitis. In a minute, we're going to go over a way to memorize all these, but I'm just going to list them out first. Well, maybe I should go think about memorizing right now. So cystitis, this is the one that's acute and uncomplicated. So maybe a good way to think of this is to think of a cysta, like a sister, but it sounds like cysta, but it's for cystitis. So there's your cysta, and your cysta, let's make a little story about her. So for one, she has a really cool eye. So E. coli. So here's her really cool eye. It's got an E shape on it. I don't know if you can see that or not, but it's a cool eye. Okay, there's her cool eye, and she's got gooey tree sap all over her hands. So that's how you can remember it. And she even got some tree sap in her cool eye. So that's the way you can memorize that. Sap for saprophyticus, and the E. coli for the E. cool eye. Okay, so TMP, SMX. Well, first of all, she's got a tree sap and her weird, cool-looking eye, and so that kind of puts her in a sad mood. So the first thing she wants to do is she wants to listen to some music with some good tempo. So she's going to get some tempo going here. Tempo, which stands for TMP, SMX. So that's going to help put her in a good mood. Now she wants to clean her eye out, her cool eye, the cysta. Remember, cystitis, cysta. Okay, so now she wants to clean her eye out and get the sap of her hand. So what is she going to do? She can't find anything except for some fluoride. So she's going to get some fluoride packets. Fluoride. And that stands for fluoroquinolones. Actually, you know what? Even better than that. Forget the fluoride. Let's say, even though she's got these cool beats going now, this nice tempo going to kind of help her feel better. Now she's decided that the thing that really is going to help her feel better about getting tree sap all over her hands and messing up her cool eye, she wants to pick some flowers. And that's going to be our fluoroquinolones. So here's our fluoroquinolones. Fluoroquinolones. And the next thing that she's going to do to kind of help her feel better is to get all of her fury out by souping up her car with nitro. Okay, so this is going to be getting her fury out with nitro in her car. There's her car there. So this is the nitrofuratin, furantoin or whatever. So there she is. First she got her music going, then she goes pick some flowers, and she goes, you know what, picking these flowers, it's not working for me. I got to get my fury out by taking a ride in my nitro souped up car. That's going to make me feel better. And she drives home. What does she get? She gets some milk. Why milk? Because lactam kind of sounds like lactose. This is the way milk used to look back in the day. You get those things. So here she goes home and gets some milk. So some beta. She says, I bet some lactose will help you feel better. So she's beta lactam. Beta lactams. So there you go. So that's what she does. So here's Sarah. She's the cysta. Not Sarah. Cysta. This is cystitis. She's infected with E. coli and saprophyticus. So she's got a cool looking eye, and she's got tree sap all over her hands, which makes her really upset. So she goes and listens to her Tempo S-Mix CDs. I don't know, whatever. That's her music. Yeah. And try to put her in a good mood. That doesn't work, so she goes and picks some flowers, so fluoroquinolones. That doesn't help either, so she says, well, I need to get my rage out. So she hops in her nitro fury car, souped up on nitro, whatever, and gets her fury out, drives home, where she gets some milk for beta lactam. So there you go. That's the first one. Now let's move on to the second one. So this is an instance next where somebody is infected with E. coli and saprophyticus. They have cystitis, but they are pregnant. Okay, you give people who are pregnant different things than you give people who are not pregnant most of the time, it seems like. So same bugs, but in a pregnant woman. What are you going to give her? Well, you're going to give her amoxicillin plus clavulanate. Those always go together, seems like. Cephalosporins. Second. And third, the MPSMX. Okay, so now we've got the story here about the pregnant lady who has cystitis. So this is a continuing story. So the lady goes in, whatever, I don't know, but now she's pregnant. So here it is. This is the cysta. But in this case, your cysta is pregnant. There she is. That's a terrible drawing. Okay, let me retry that. Hold on. There we go. Okay, so now she's pregnant. I don't know, whatever. Okay, so pregnant cysta. Same thing. And so the pregnant sister, she still got the cool eye. And once again, she's got the sap all over her hands. But she's prego. Okay, so what is the pregnant sister going to do? Well, as you know, people who are pregnant, typically, they have really achy feet because all the swelling and edema goes down to their feet. And when you have really achy feet, what do you want to do? You want to put on your moccasins, okay? So that stands for moxicillin. That's the first thing she does because her feet are killing her. These are her moccasins. I have no idea how to spell moccasins, but that stands for amoxicillin. And you can even think that she pulls her moccasins out of her cave. Okay, because clavulanate kind of sounds like cave. So maybe it's her cave moccasins for clavulanate. Whatever. Okay, so cystitis. Okay, so now this pregnant cysta is going to she's going to take some cephalosporins. So how can I remember cephalosporins? I'm guessing it's going to be a 3rd generation cephalosporin. Ceph kind of sounds like chef. Okay, so what does she do? And now she's got her feet feeling happy, and she's like, oh my goodness, the baby's hungry. I need some food. I gotta go visit the local chef. So here is the local chef, and he is more than happy to cook up some delicious food for her. It's supposed to be an apron, whatever. Okay, so there's the chef. Stands for Ceph. And usually, like I said, chef. Usually, like I said, seems like they always use 3rd generation, but I don't know in this case. I'll have to look that up. If it's 3rd generations, maybe like ceftriaxone, ceftaxime, or those kinds of ones. Ceftazidime. If it's 1st generation, there's whole different names for those. But it seems like all the cephalosporins start with cepha something. 1st generation like cefaflexin, cefazole, and whatnot. But anyway, there's her ceph. So that's the second thing. She got her feet feeling good now. So now she's going to go visit her chef to really feel good. And when she goes down and sits down to music, the first thing the chef does is he puts on some nice music for her to listen to with a good tempo. That's going to stand for the TMP SMX. And that's the 3rd thing that she can do. So first, she gets her moccasins on. Then she goes, visits her chef to make her up some food. And then 3rd, the guy plays the nice music for her, the TMP SMX. So there you go. There's the story for the pregnant cysta. Okay, got that down. Good. Moving on. So now situations change. We're not talking about cystitis anymore. We're talking about the cysta. Now we're going to be talking about acute pyelonephritis. Uncomplicated first off. So pyelonephritis. Different bugs, kind of, not Saprophyticus anymore usually, just E. coli. So for acute, actually we're going to talk about two versions. We're going to talk about the E. coli version, and we're going to talk about the gram-negative version. But first of all, let's talk about the E. coli version. So for acute pyelonephritis, we're going to tell the story about the, let me think of a good idea here. Okay, how about the, this is the guy who decided to make a pile of O's. So pyelo. Is that a good story? Yeah, sure, whatever, we'll go with it. So this is a cute person, makes a pile of O's for pyelonephritis. Okay, so acute, make a pile of O's. So there they are with a pile of O's. And in this story, this is the one, there's going to be 2 guys that do this. 2 brothers. I might as well get them both in here. And one of them is a cyclops, so he's got one big cool eye. And the other one is really negative all the time. That's the gram-negative one. So the 2 stories. So you got the E. coli, cool eye, and then we've got the gram-negative over here. Okay. So they're both making a big pile of O's for pyelonephritis. So what are we going to do here for the coli guy, the E. coli? Well, one thing you should know about the coli is that he loves his name, because his name's really cool. His name is Quincy. Quincy. And he always likes to be alone. So Quincy's all alone because he's got his weird looking cool eye. He's a cyclops. So Quincy alone, Quinn alone. Okay, so that's his name, Quinn alone. Wasn't that same thing as fluoroquinolones? It is. Oh, why didn't he try it the same? Whatever. Okay. Maybe you can also remember that he's alone because he likes to pick flowers by himself. Fluoroquinolones. Whatever. Okay, so that's the first thing you use for him. And second line is, when he gets all alone in these flowers, whatever, the second thing that he likes to do is he loves to listen to the tempo or the music of nature. So then he's going to get the tempo going, TMP, SMX. And that's really going to get him in the mood to make this pile of O's. And now plus 1 gram of ceftriaxone. It looks like they also add a gram of ceftriaxone to this too. So I'm just going to put a little axe down there to remember ceftriax. Because if that doesn't work, the music doesn't work, then he'll try the axe. I don't know. Whatever. Okay, now going over to the gram-negative guy. So what do we do for gram-negative? Well, one thing about the gram-negative guy is that he stole the moccasins from the pregnant lady because he was so mad. He was so negative that he said, I needed to take her moccasins. Or maybe she said, you know what? You look really angry, gram-negative guy. So maybe you can borrow my moccasins. Maybe that'll help cheer you up a little bit. So he's wearing the moccasins. So amoxicillin. Moccasins. And I guess that's pretty much all you do. So there you go. So he's wearing the moccasins. This guy over here, he's got the fluoroquinolones, his Quincy, and he's listening to his TMP SMX music, and he's even thinking maybe I'll try the axe on these O's if that doesn't work. Whereas this guy who was feeling real negative, and so now he's got the moccasins from the pregnant lady. Okay, so now next one we have here is complicated pyelonephritis. Okay, so this was a simple pile of O's. I'll maybe write that here, simple. But now we're going to get complicated in this. Okay, so let's erase this. And let's draw a complicated pile of O's. And this complicated pile of O's is going to be some kind of really dynamic structure of O's. That looks complicated, doesn't it? Yeah, it's beautiful, very complicated. So this is complicated pile of O's. Okay, so pyelonephritis. So complicated pyelonephritis, complicated pile of O's. Yeah, very complicated. Okay, so what's going to happen with this? What are we thinking here? We're thinking E. coli, P. mirabilis, K. pneumoniae, P. aeruginosa, E. faecalis. Oh my goodness, that's a huge yucky list of things. So we're going to make this simple. We are going to put down just the first letters of each one. I'm going to make a word out of it. So we got we're going to put down E for E. coli because we're going to need probably going to need the letter E in here. And oh, look at this. This is pretty nice. It makes the word keep. Okay, so keep. K, E, E, P. So E. coli, E. faecalis, or whatever. I think it has to do with feces. Faecalis. P. aeruginosa. And K. pneumoniae. So keep. Yep. Keep. And maybe for the second letters, you could just remember PC, FA. I don't know what the heck to do about this. Good luck. There's a lot of bugs here for complicated. So what are you going to do for this complicated pile? First thing you're going to do is, in order to make this complicated pile of O's stand up, you need to choose a good place to stack it up. And the best place to put a big complicated pile of O's is always going to be in a field where there's lots of flowers, because the flowers will complicate the beauty of the complicated pile of O's. So fluoroquinolones. That's going to be your first thing to really take care of this pile of O's. So there you go. There's your flowers. Fluoroquinolones. Okay, so if the flowers don't work, it's just not enough, you can use some extended spectrum penicillin plus parenteral aminoglycoside. Okay, so extended spectrum penicillins. Well, you know, penicillins, this is kind of a stretch, but penicillin, I was going to say it's basically based off of a mold, but I think maybe rather than doing the mold thing, if that works for you, I'll put a little mushroom here just to know that it comes from mold, even though mold isn't really a mushroom, but whatever. Maybe the thing I'll do is, well, you need to brace it with some pencils, but they're extendable pencils. They're really long extendable pencils. So here's a nice extendable pencil. Put in there. There's another extendable pencil. That'll really help keep your complicated pile of O's together. There's another extendable pencil. There's another one. So that'll hold that complicated pile of O's together. So pencil, penicillin. I spelled that wrong. Extended spectrum penicillin. And as well as an aminoglycoside. So there's quite a few aminoglycosides. So I'm not really sure which one they're wanting us to use here, but I mean, these are going to be ones like streptomycin, neomycin, all these ones. They all end in mycin, seems like. But maybe what I'll do for this is I'm just going to put down amine. So aminoglycoside, and they usually end in mycin. So I'm going to put down amine mice. And the mean mice come and they knock down this extended pile of O's. That's really what does the job. So here's going to be a mean mouse. Here's another mean mouse over here. So aminoglycoside. Why does that have wings? Okay, there's the ears. There we go. All right, so mycin. You gotta be careful because there's other drugs in mycin too, like erythromycin, but that's a totally different class. So we're thinking aminoglycosides. Aminoglycosides. These are mean. They're mean mouse. Angry eyebrows. And maybe you can think for the glycosides, they're glider. Maybe they have a glider. They glide in. There we go. The mice glide in on their gliders. So here's another mouse gliding in. There you go. So there's your mean mouse, aminoglycosides. And there it is. All right. So that's how we're going to take care of, really quick recap, complicated pile of O's. we're thinking we got to keep it. Got to keep this complicated pile of O's. So we're thinking K for K pneumoniae, Klebsiella pneumoniae, E for E. coli, Escherichia, or how the heck you spell that, E. coli. Then E for facialis, and P for Pseudomonas aeruginosa. So keep the cool pile of O's. So how are we going to keep it? Well, first of all, we're going to put some flowers down at the base. That's a really beautiful thing. So flower stands for fluoroquinolones. And also, just to really make sure that it's going to be held in place, we need some extendable pencils. So that's going to be these are these pencils here. And that stands for extended spectrum penicillins. And next, if that extendable pencils, they're still not enough, so we're going to need some penicillin. Oh, that was the penicillin. Sorry, extendable pencils. Sorry. Then if that doesn't work, then what happens is the mean mice on their gliders, the mean glider mice, aminoglycosides, streptomycin, neomycin, whatever it is, tobramycin, they glide in and they're going to knock this thing over. So there you go. That's the story of that one. Okay, next. So now what we have is prostatitis. Okay, prostatitis. Prostatitis, and this is usually going to be caused by PPKEP. So this is, PP. So this is going to be E. coli. It's going to be caused by K. pneumoniae, same thing as the other one. It's going to be caused by Proteus mirabilis, and it's going to be caused by P. aeruginosa, Pseudomonas aeruginosa. So P. aeruginosa. I don't remember how to spell that. Whatever. Terrible. So aeruginosa. So PP. PPEC. I don't know. Goodness, there's not really any good acronym for this one that I'm seeing. But PPEK. That's I guess that's the best I can do. Or maybe you could say KPEP. K. So, whatever the heck that means. So, okay. For this one, we're going to use a number of drugs. We're going to use, I'll put a KPEP over here. And then I'm going to put the drugs over here. So to treat this one, we're going to use quinolones first. Fluoroquinolones. We're going to use TMPSMX next. Third is going to be tetracycline. And fourth is going to be macrolide. Okay, prostatitis. This is where someone has an inflamed prostate. So this here is a guy who has an inflamed prostate, and it hurts. It makes him hard to pee, so he ends up having to go to the hospital. So he's not very happy about that. But to cheer him up, his family comes in, and on the little table at the base of his bed, they give him some flowers as they visit him in the hospital. And those flowers help him feel better. Or quinolones. So there's his flower. So, you know, that's helping him feel a little better. So the nurse comes in and says, "How are you feeling?" And they say, "Well, you know, I'm feeling pretty sad." because my family left, but they left me this flower. And she says, oh, well, I've got something that'll help take your mind off of the sadness that you're feeling. I'm going to play some music for you. So the nurse puts on some music for this guy. But the station gets bumped to rap music. And he's not really a fan of rap music. So, but it's got a lot of tempo. Tempo, TMP-SMX. So anyway, the rap music is playing, and he's like, man, I don't like this rap music. I am going to play Tetris or go cycling. So he's trying to decide. He says, what should I do? I want to get out of here. I wish I could be playing Tetris or go cycling. So he's holding up his little toy bike here. Because that's kind of weird, but whatever. So there's his cycling bike. Cycling. And this is his game controller to play Tetris. So there's Tetris cycling. So he's thinking, boy, I wish I could be somewhere else playing Tetris or going cycling. Or maybe he's going to go cycling to go play Tetris at his house. He wants to get out of here. And just then, his family comes back and they said, hey, we went to McDonald's and we bought you a Big Mac. And he likes Big Macs. And so that puts him in a better mood. He decides to stay. So here's his Big Mac. So he stays and he eats his Big Mac. And the Big Mac stands for macrolides. And there is the, he decides to stay there. And that gives him a little bit of pep. Okay, he's got some pep. Pep, okay, whatever. Okay, I don't know, that's a stretch. Note on this one that says chronic prostatitis may require longer treatment period and or surgery. All right, good to know. All right, so that's all the different situations for this upcoming exam.